Now we're going to transition to folks from the Office of Child Support Services. Mr. Allen is the Assistant Deputy Commissioner. So stay tuned and enjoy. Allen, all yours.
Thank you so much. Good morning, everyone. I want to thank the team at the Bureau of Health Statistics, Department of Health and Hygiene, amazing partners in this work, as well as the team of the Temporary Disability Assistance Division of Child Support Services, and of course, our team here at Child Support Services welcomes you and thank you for attending this morning. Then Alan Farrell, Assistant Deputy Commissioner for Parent and Community Engagement here at New York City Office of Child Support Services. So moving right in to our presentation. So as far as our agenda is concerned today, first we'll do a brief overview of child support, and the Assisted Child Support Services involvement. Next, parentage establishment and child support. Call to action, resources and tools, and initiatives. So some of you may be familiar with the child support program, others maybe not too much, but one thing we do know is that healthcare program can be fairly confusing at times. But for the purposes of this presentation, a few points about what the Child Support Services Program is about here in New York City. So the first thing we want to say is that OCSS puts children first. And from the left, you can see that our first goal is to locate parents. Next, the third part of today's presentation and conversation is to establish parentage. Third, to establish orders in partnership with the court. Fourth, to enforce those orders. And finally, assisting parents with employment and debt management. OCSS's involvement in establishing parenting. So as we've heard previously, certainly we cannot do this work without the partnership and efforts of our hospitals and clinic partners. Certainly to the Department of Health and Mental Hygiene, we've heard the work that they do in not only facilitating the distribution of that data and repeating that data to the state level, to our partners at the Office of Temporary Disability Assistance, and certainly then to the Office of Child Support Services, because without parenting, a child support order cannot be established. Right? So not only are we seeing that in yesterday frame that land over and over discussed about the rights of the child, but it's the inheritance, right? Veterans benefits, Social Security, etc. But then also where the child support order needs to be established, it cannot be established unless parenting is established. Moving right along, our birth, as we know, brings parents together. So according to Fragile Families Project, 90% of fathers either mother or baby. 85% say that they want to help raise their child. And 94% of mothers say they want their child's father involved. So just to say, even with the 95%, that item, here at the Support Services, we believe that generally speaking, fathers want to be involved in the lives of their children. And so we want to do everything possible to ensure that that is not only, but certainly through So with that, in-hospital parentage is key. It is the leading method for establishing parentage. Some of you may already obviously know this, but it bears repeating the importance of your work in partnership. Research shows that by nearly 40% in hospital voluntary parentage acknowledgement programs have raised parentage establishment rates. Estimates suggest that in-hospital parentage establishment accounts for up to 84% of all paternities or parentage established. Very important to know.
So involved parents make a real difference to kids. And I know I alluded to this a little bit a short while ago. So when fathers are actively involved in their children's life, children are more likely to finish high school, less likely to use drugs or other substances, less likely to have behavioral problems, less likely to be involved in the criminal justice system, and less likely to become a teen parent, right? So that early onset of pregnancy, they're less likely to do that when they have involved parents and involved fathers. And this is a very important slide, right? Parentage establishment for unmarried births in New York City hospitals. So when you look at for calendar year 2024 through December, 97,301 live births. All right. Of that percentage, 62,556, that's 64% of the births in the hospitals were married families. Married parents. 36% were unmarried, but of that, right, only 76%, which is great, signed an AOP. But then you see that number in the right on the right, unmarried without an AOP, still 24%. So there is a great opportunity to continue to make an impact by assuring that an AOP is filled out accurately so that the rights of both parents and children are realized. So we have a great opportunity here. So let's look at parentage data through the years. We noted that their federal parentage establishment percentage threshold is 90%. And so, but you can see throughout the years, we've been 83%, 85. So you can see it climbing up to 2021, 89%, and then a bit of a drop in 2022, but still in the 80s. So really 2024 was the first time that we saw that, a drop in the overall parentage establishment percentage. Even though live births were relatively high there. So that's interesting to note that. But we've been doing very well over the years. We want to get that number back up in 2025 and beyond. So these next two slides, I won't read them through, but it just shows it's over 100 of our partners in our hospitals that facilitate the accurate completion of an AOP, ensuring that parents' rights and children's rights are realized through Parentage. So these are all of our data partners, and this is how we know how we're doing in terms of completed AOP and accurate AOP. So what is the relationship to the child support program? Parentage establishment begins with signing the acknowledgement of parentage form. It is fundamental to the child support process. All right. So since a court will not issue a child support order without first determining parentage. And finally, child support is one of the strongest anti-poverty programs in the nation. Child support income combined with other supports can help lift low-income families out of poverty. So that's very important to know. Child support program is one of the strongest anti-poverty programs in the country. This is well noted in the data and research. So let's look at collections over the past 5 years. In 2020, we saw a great increase of $863 million collected, right, because of the stimulus checks were seized then, but then you can see we've got a drop in 2021 and beyond. But again, what we're working to do is make sure that parentage is established so that child support orders can be established and children and families can receive the funds that they need to grow and thrive here in the city. This is also a very important slide. Child support vital to low-income custodial parents. Increasingly, what we are seeing is that child support is a major critical part of income into a household. So you can see child support represents 41% of the income of low-income custodial families. And this is important to note, particularly here in New York State. Other states, I believe, TANF can stop maybe after 3 years or 4 years, but for all intents and purposes, a family can continue to receive the TANF benefits that they need. And so child support can become a continual flow of support to the family to lift them out of poverty. So this is our call to action. So today, we are here to continue to think about ways to improve the AOP process, to explain the benefits and importance to both parents of signing of the AOP at the hospital. And together with partners, you are partners to raise awareness of the benefits and process of signing the AOP at the time of birth. We want to ensure parents know the legal implications of signing the AOP and that it can be withdrawn within 60 days of signing. So we want to underscore our partnership with Department of Health and Mental Hygiene's Bureau of Vital Statistics. Again, a partnership to guide hospital staff on the AOP procedures, which we're doing today. So thank you again for attending. We want to strive for quality improvement. We want to inform expectant families about the importance and advantages of submitting AOPs at the time of birth. Very powerful moment. And again, the relationship between OTDA, Office of Temporary Disability Assistance, and Parentage. The Office of Temporary Disability Assistance focuses on the AOP for the programmatic reasons described earlier. OTDA also works closely with the State Department of Health to report AOPs to the Federal Registry. And this information, again, really helps child welfare when looking for fathers at the time of adoption, when they're needed to surrender their rights. And the number of unwed custodial parents who sign an AOP contribute to the state's overall parentage percentage. So all states are expected to meet a 90% parentage rate to qualify for federal incentive payments. Noted that earlier. And we're also very glad to have our state partner on the call, so she'll talk about that a little bit. But OTDA offers 2 biannual training sessions, typically February and August, on acknowledgement of parentage for hospitals and acknowledgement of parentage for registrars. So certainly you can sign up for that. Parentage mailbox is there. The email address is available to address questions from hospitals, registrars, parents, child support workers, law office, or anyone with questions. And typically those our questions are addressed within 24 hours. We are very fortunate and happy to be able to offer low-cost DNA testing. And this is critical to the establishment of parentage, as we know that DNA tests purchased from Rite Aid or Walgreens are not acceptable into courts. And a lot of times families don't know that. Services, as we know, DNA tests purchased at Rite Aid and Walgreens are not accepted in the courts. And so it was very important for us to get a contract with a reputable DNA testing firm and be able to offer these low-cost tests. And obviously you go to Rite Aid and those places, it's $100 and something, and again, it's not acceptable in the courts, and oftentimes families don't know this. So please feel free to share these resources with the families that you serve. Detailed descriptions of the child support process, our special programs, and the program's impact are available online in our biannual report. This just came out, so this is hot off the presses. So we certainly hope that you will avail yourself to learn more about the child support program here in New York City, and all our programs, and ways that you can not only ensure that parents are accurately completing the AOP, but also accessing other services that they might need. And finally, you see our contact information. We have a robust website full of resources and information for both parents, as well as information on mediation, DNA, etc. So Sandra will send that link. We have a contact flyer with a list of all of our offices, emails, phone numbers, addresses, and then general child support questions can be sent to our state email located right there on the slide.